My name is Molly Fessler, and I am excited to be presenting evaluation of pediatric dermatologic education and exposure in undergraduate medical education on behalf of my co-authors. This project was born of the realization among medical students during our clinical year that traditional clerkship education often suffered from a paucity of diverse images. This was particularly salient to us during our pediatric clerkship, and at which time we sought to better understand medical student perceptions of their education, exposure to images of children of color, and the perceived importance of this education by medical students. And so that's really where the impetus for this project comes from. And we consider this to be a preliminary needs assessment, one that we hope will inform future efforts to guide the creation of enhanced curricular tools that increase diversity in medical education. So to start here with a little bit of the background, common pediatric cutaneous conditions are often misdiagnosed due to inadequate dermatologic training. This problem is exacerbated in children of color, particularly due to physician unfamiliarity with presentations in this population. Undertreatment of these conditions leads to health and psychosocial disparities, as you might imagine. And our evaluation assessed medical student exposure to pediatric dermatology and pediatric dermatology education in children of color via IRB exempt optional survey. And so in terms of our methods, we surveyed first through fourth year medical students at a Midwestern medical school. And students rated their agreement with statements on a 7-point Likert scale. This Likert scale ranged from strongly agree to strongly disagree. So you can see the statements that the students responded to on the right-hand side here. And these statements were evaluated with, or rather the data, was evaluated with paired t-tests. The statements that we asked students to reflect upon included: 1, I feel confident I could adequately identify dermatological conditions in children with non-pigmented skin. 2, I feel confident I could adequately identify dermatological conditions in children with pigmented skin. And then students who had completed their clerkship education in the clinical setting were asked to rate agreement with the following statements: I have had adequate education related to dermatologic conditions in children with pigmented skin during my clinical education. And so in terms of our results, which we can see down here, we had 245 out of 892 students for whom it was possible to receive this survey respond. So that was a response rate of 27.5%. Of those who responded, 53% agreed, and whether that was strongly agreed, or somewhat agreed, that they could identify these conditions in children with non-pigmented or white skin, while only 16% responded affirmatively that they were able to identify these conditions in children with pigmented skin. And this was a statistically significant difference. Of the 59 clinical students who responded to our survey, 83% responded that they disagreed in some manner with the statement that they had had adequate exposure to dermatologic conditions in children of color during their clinical tenure. So in terms of conclusions for this really preliminary needs assessment, we first acknowledge that our findings are limited by sample size as well as the voluntary nature of the survey. They do signal, however, that many medical students at one institution perceive inadequate exposure and limited education pertaining to pediatric dermatology in skin of color during their clinical training. And so next steps would include implementing a curriculum to address these educational disparities and we hope to encourage others to think about ways to identify and address these disparities when it comes to other types of clerkship education as well. Thank you.